So I think I just wanted to start by saying that the survey and the reach that it has across our Suffolk schools is just incredible and continues to grow and grow the more engagement you guys are doing. And the fact that we can actually listen to our children and young people effectively through a survey which we help to develop, but obviously is driven by you guys, gives us that real opportunity to listen, to reflect, and to look at how things are currently operating within the Suffolk system and whether we're actually doing the right things. Because I think from a children's perspective and from a young person's perspective, you know, all that matters to them is that the support is there when they need it. And it's not right for us to make assumptions about what is right or wrong for them. They need to tell us what's right for them. And I think the ability to be able to capture that through a survey, which is so wide-ranging, and obviously my focus area has been mental health, and that's my role as a commissioner to commission mental health support, but it gives us so much more than that. And I think the fact that we've been able to then share that with our system leads through the CYP committee, with Suffolk County Council, with our school leaders, with our voluntary sector, and through our providers like NSFT, we're able to talk to them about the wider impact that's happening for young people at the moment and how we can share that knowledge and information and really show that we can listen and react to that. And I think that's what we've successfully done over the last 3 years, which I've been involved. When we've looked at the results alongside you guys, you've been able to share the insight, but also talk about how that potentially could impact not just the child, but also the family as well. And I think in COVID, particularly when you did your survey during COVID, it was really important for us to understand how we would need to make a shift in some of the services that we were commissioning, alongside some of the traditional stuff that we knew that was working quite well. So Kooth was a classic example of that. So a purely online counselling service available to children from the age of 11 to 25. That really came to the fore through that survey, that we needed something different that people could access in their own time, where they felt safe, that was truly confidential, and that, you know, gave them an opportunity to link with other children and to professionals as well. So Kooth kind of gave us that, and that was a direct result of the information that we had from the MHOF survey. And we've continued to commission that, and we've actually just recommissioned Kooth for a further 2 years in Suffolk, and we've actually grown their offer as well. So we're now using Kooth to target some of our wait lists as well within CAM services, which is something that we've never done before. So again, it's not just the initial commissioning of Kooth, it's then the evolution of how that service continues to support young people as we get more and more feedback about, and now what else. I think that also opened the door in the survey to look specifically at things like the VCSE and what else was out there. So traditionally, we obviously put a lot of our funding into places like NSFT, who are our main provider for mental health, but we wanted to ensure that we were meeting all children's needs, and that might not necessarily be through that route. So we worked with the VCSE, following feedback from children in the survey, that actually it wasn't just always about a CBT or something like that, that actually something different might help them. So things like Greenlight Trust, Noise Solutions, to providers locally who we've been doing some fantastic work with over the last 2 years, has shown us that there's alternatives out there, and they are becoming part of our mental health offer generally, not just seen as an add-on. They are part of a overall solution that we can put in place for children and young people who might be suffering emotionally or with any type of mental illness as well.